In asphyxia, there is an inadequate supply of oxygen to the tissues, and we are talking about the different types of asphyxial death over here. So, in this section, we'll be dealing with the gagging and another type of asphyxial death, which is also known as choking. How do you basically differentiate between these gagging and the choking phenomena? Gagging, the levels of the entry of the obstruction are again very important whenever we are talking about the asphyxial death. Gagging can be basically caused through the at the level of the epiglottis, and that is basically going to cause the gagging reflex. And then there is a choking phenomena. Choking can be basically, there are two types of choking. There can be an air choke and there can be a blood choke. So whenever the choking phenomena, the basic pathology is at the level of the jugular veins involved, then this is basically called as the blood choke. And whenever the choking is at the tracheal level, then we are going to refer it to as the air choke. So these gagging and the choking are discussed in detail over here in this fourth section. So in the fourth section, we'll be dealing with gagging and choking. How do you basically define gagging and choking? What are the conditions that are going to be required for the formation of the mode of method as the gagging phenomena and as well as the choking phenomena? How are we going to differentiate? What are the autopsy findings are of course going to be the same as that of the asphyxial death that we were already discussing in different kind. Whatever the method of asphyxia, the autopsy findings are going to be the same. There's going to be petechial haemorrhages, there is going to be the edema, there is going to be the cyanosis, the engorgement of the vessels are going to be noted in the neck and even in the face, and there is going to be the enlargement of the right side of the heart. So these are the autopsy findings in general whenever we are talking about them. And then even at the tissue level, there is going to be a lot of damage, and the blood markers are again very important. For example, the hypoxanthine was the main blood marker. So all of these autopsy findings are going to be found even in any types of an asphyxial death, let it be the gagging or the choking or the suffocation or the smothering phenomena. So the gagging. How do you basically define gagging? It can be at the epiglottis level. A pad or a gag is fixed over the face, and the air entry is basically blocked into the air passages. So that is basically the mainstay over here, whatever we are talking about. And the nasal airway may originally be quite patent. So the nasal apertures are quite patent, the nasal airway is quite patent, the respiratory orifices are quite patent, but the mouth is covered over here in the gagging phenomena. Although the person can still use the nasal orifices. Now it is of some traumatic kind of an asphyxia in which trauma is also involved to the chest. So the person is unable to breathe and let the air in. That is the basic pathology behind it. That is what we are talking about right now. And then we have to keep in our mind that what is the medico-legal significance whenever we are diagnosing any death as the gagging phenomena. It is usually of a homicidal kind. It is very rarely, or even it is not possible that it occurs accidentally. It is not possible that it occurs in a suicidal manner of death. So we have to keep in our mind that whenever we come across a gagging phenomena, it is of a homicidal type of phenomena. Then suicides can rarely be a cause to these gagging phenomena, but not very common. Moving on to the choking phenomena. Choking is basically when a bolus of food is stuck in the air passages, and it is very common. What are the other names which can be used for this choking phenomena are the cafe coronaire syndrome. So it is another terminology which can be used for this choking phenomena. There are a lot of modalities in which we basically apply compresses, 3 equal compresses at regular intervals just to avoid the person from de-choking a person. So these are basically methods of de-choking a person, and that can be used for this process. Now, how do you basically define choking? Choking is the blockage of the internal airways, usually between the pharynx and the bifurcation of the trachea. So the level of the obstruction have to be kept in mind. And again, I'm emphasizing on this fact that why does this choking phenomena occur. This is very important. Usually the cause behind this formation of the choking phenomena is the bolus of the food that we have to keep in our mind. And again, the pharynx and the bifurcation of the trachea is the level that is basically blocked whenever we are talking about the choking phenomena. Now what happens, what are the causes for this choking phenomena? As the most important cause is the bolus of food, but there can be foreign bodies that can also enter the respiratory or the airway passages that can cause the blockage of the air entry. Then we can have the dentures and the hemorrhages. Hemorrhages is another cause which can basically cause a blockage of this tissue, cause the blockage at this level of the pharynx and the bifurcation of the trachea. The artificial dentures, they can be again dislodged and they can enter into the airways. And then we can have an acute obstructive lesions that again are going to contribute towards this choking phenomena. Food material. So food material, whenever you're eating and that bolus of food accidentally goes into your airways, it is going to block the airways. So as we can see through these causative phenomena, that what can be the medico-legal significance to this choking phenomena. The most important medico-legally, it can be an accidental cause. It cannot be of a homicidal or a suicidal cause. Usually it can be of an accidental cause, and that is why it is known as the café-coronaire syndrome. So we have to be very clear in our mind how do you differentiate between the gagging and the choking phenomena. Again, the levels are very important. Gagging as at the level of the mouth, and the choking occurs between the bifurcation of the trachea and the tracking ring. So this is basically the level of the choking, the level of the obstructions that we have to keep in our mind whenever we are talking about differentiating between the gagging and the choking phenomena. Now this table is a very comprehensive review how we basically differentiate between these two phenomena. The child will open the mouth and thrust the tongue forward and the face may appear bright red. So this is basically how the gagging phenomena occurs, and in the choking phenomena, the child will begin to turn blue. This is basically the presentation at the scene. So in a gagging phenomena, there will be a reddish discoloration, and in a choking phenomena, there will be a bluish discoloration. At the second point, we see that the child will sputter and cough. This is the reflex, that is the gag reflex that we are going to refer to as. And the child will be silent and unable even to make a noise in the choking phenomena. Then again, the children have a very heightened gag reflex and designed to keep them safe. It is basically nature's way to keep them safe, and the child may start coughing if it is a partial blockage. So we have to keep this in our mind. Do not interfere with a gagging child because it can go into the choking phase. And if the child is silent and turning blue, proceed using the standard first aid measures to dislodge the blockage. Now, as I was referring to, as there can be a blood choke, and even there can be a air choke. In this figure, you can see that there is a blood choke at this level where the jugular veins are basically compressed. And this is a method which was referred to as the mugging. Mugging is basically a type of asphyxia in which the bend of the elbow is used to compress the neck. So it is basically the mugging that is the underlying pathology in the mugging is the blood choking. And then we have the air choking. Air choking, what happens over here is that the bolus of food is going, or even a foreign body or the artificial dentures, anything foreign can block these tracheal rings. So in this section, basically, we dealt with the gagging and the choking phenomena and how are they important, what are their underlying pathologies that are discussed over here. That is the end to this section. Thank you for watching sqadia.com.